What are the common lifestyle diseases that you come across in your practice, and what advice do you give to those patients who are at risk of developing those diseases?
Yeah, very important. We see that overweight and obesity in the last 2 decades, it is no longer confined to the Western world. I see many people in India, 40% of adolescents, children, adults, they are overweight or obese. And as a result, other two metabolic disorders, diabetes, high blood pressure, 1 to 2 out of 5 people, they have these illnesses. And then if you extrapolate those two to other attack and strokes, the incidence actually has gone up despite a lot of awareness. We are seeing younger people getting heart attacks and strokes. So it is possibly related to the lifestyle and also sleep.
In addition to prevention of diseases like stroke, diabetes, high blood pressure, heart attacks, you have also spoken about the prevention of cancer on your YouTube channel. I was quite intrigued to see that video of yours. Would you please share some insights with our viewers and listeners about the prevention of different types of cancers?
The top 3 or 4 common causes of death and disability, other than heart attack and stroke, cancer is the leading cause. If you look at women, breast cancer, cancer of the cervix, still common in India. In men, lung cancer, cancers of the liver, gastrointestinal tracts, colonic cancer. And then when I'm looking at the risk factors, because I'm interested in prevention and the lifestyle, I realized that many of the same risk factors which work towards say diabetes, heart attack, and strokes, they also work for cancers. And I was surprised to find that obesity is one of the commonest risk factors for cancer, which can be prevented. And then unfortunately smoking in India, it has been common for last several decades. Even today young people smoke. Smoking is a risk factor for many cancers, not only lung cancer. Almost all cancers in the body, they increase because of smoking. Alcohol, literature, they say that small amount of alcohol is good, but today as per WHO and many other scientific bodies, no amount of alcohol is safe. And alcohol is a risk factor for several types of cancer, not only liver cancer. We talk about development, but development brings many other problems, and one of them is air pollution, Delhi being the pollution capital of the world. So air pollution is one of the risk factors for many illnesses: hypertension, diabetes, strokes, heart attacks, and also cancer. And many of the preservatives and coloring agents could be also one of the causes of cancer. We know that plastic is harmful, and we are trying to do away with the plastics, but despite so many laws and regulations, it is not being followed. Not only the major plastics, but microplastics. So microplastics, many studies have been done, and they have shown that vital organs, there is a deposition of microplastics, and that not only they increase the risk of strokes and dementias, but they are implicated in different types of cancers. And cancer of the cervix is caused by human papillomavirus. There is a vaccine for it, and government of India is promoting it. So hopefully we can reduce the risk of cancer of cervix. And similarly, breast cancer, mammography, and few guidelines are there. So these are some of the cancers which are unfortunately common